Hi, my name is Terry Dorland with Rise Local TV, and today we are very, very excited to be joined by Dr. Jeff Jarris, who's an optometrist in Marietta, Georgia, and we're going to be discussing finding a new optometrist and really the steps you should be taking when you're out there looking for a new optometrist. Dr. Jarris, how are you doing?
I'm doing great, Terry. Thanks. How are you?
I'm doing well. It's great to have you here. So,
Thank
Dr.
you.
Jarris, help us here. What should, you've been doing this quite a while. You're obviously very good at what you do. Talk to us a little bit about the steps someone should take and the questions they should ask really when they're looking for a new optometrist.
Okay. Well, it's important to start out knowing what you're really looking for. Everybody's got different expectations of what a great eye exam is like, and there's a confusion, I think, in eye care and customer service. There's great eye care and there's great customer service. Very different things, and sometimes they're at odds with each other. You might get a really fast eye exam that's nice and convenient, great customer service to get people in and out quickly, but it may lack the thoroughness that a longer eye exam would take. So it just depends on what you're looking for. Everybody's not looking for exactly the same things. There are all sorts of eye doctors out there, all sorts of settings for eye doctors. There are private practices, there are commercial places. Just depends on what you really want to get for yourself. It would really be helpful to know some questions to ask when you're calling around. Most people start by looking at their insurance provider list, and they kind of look at, all right, let's see who's close. And maybe they've gotten some recommendations from friends and family or coworkers, and that's all great. Maybe you think you're calling up a great eye doctor, but that eye doctor needs to be great for you. It could be great for everybody else, but maybe your particular problem he's not so great at. He's not an expert in. So that's the kind of thing when you call around, you want to get a receptionist who will answer your questions. You might say, hey, is the doctor an expert at fitting bifocal contact lenses or astigmatism contact lenses? And those kind of things are really a good way of making sure that you get the best care possible. You might want to let the receptionist know if you're having a particular problem with your vision. We always ask people when they call us. It doesn't matter the questions that they ask. We're always going to try and figure out what vision problem they're having, or if they're having a medical issue. Let's say they're having a whole bunch of floaters that are really scary, and we would want to know that so we could get them in right away. Same with if somebody broke their glasses or their dog ate their glasses and they're leaving town. We would say, oh, well, we need to get you in right away. So when you're calling around, you might get a receptionist who just answers your questions very matter-of-factly and without really any emotion. They're not really taking care of you. They're just answering your questions. You might also call around and find a receptionist who says, well, how can we help you? What's the matter with your eyes? What's going on? What can we do for you? And then you start letting them know, and you get into a conversation, you get into a relationship a little bit, and we start finding out more about what you need and what your expectations are. And then you start getting a sense of, hey, these people are taking care of me. And that's a really good indicator of how the rest of the exam is going to go if the very first person you talk to is trying to figure out what they can do for you. So it's really great to get somebody on the phone like that. You just feel such a difference. You feel like you're getting taken care of. We really try to make a point of doing that, reaching out through the phone and getting people to know that we're really interested in taking care of them. So, what kind of questions can you ask us? Well, you might want to find out if the doctor has all sorts of new technology equipment in the office, if they're up on the latest contact lens materials and eyeglass materials and things like that. You want to know if the doctor is a really good listener. Does he think outside the box? Is he somebody that never gives up on a case? If he can't figure out what's the problem right away or the proper treatment, will he give up and say, I guess you just have to live with it? Or is this the kind of doctor who will say, no, we're going to keep on trying until we fix your problem? The buck stops here. That's the kind of doctor that you want. And, it's just really nice to have this back and forth where when you come into the office, we help you fill out the paperwork. The technician takes you back and explains the reason for all the tests. So you're not thinking that we're just doing a whole bunch of stupid tests that nobody pays attention to. All the tests have some importance. We never know when somebody's going to do poorly on a particular test that means something really important to the doctor. So then you get a hold of the doctor, and does he look at all the test results and discuss them with you and answer all your questions? Do you get to ask questions of him? Does he explain things really well? And then does he present different options to you for treatment? Because if a doctor just presents one option to you, there's a good chance that he's trying to get you to do something that's good for him, and maybe it's good for you too, but it's really important that it's good for him. Well, you want options because there are always different options. And some people choose the best option, and some people say, I can't really do that right now, but I can do the other option. That sounds really good. I'll do that. And the doctor should not judge you about that. He should say, look, everybody can do what they can do, and this is a plenty good option, or I wouldn't have presented it. So, he needs to empower you to make the best decision for you, not what he wants you to do. We try to do that. We try to be very non-judgmental about people. Our opticians don't try to push glasses on people. We explain the latest things, the latest materials, and people can decide.
So it sounds like you've got, the focus that you have here is, look at your insurance, ask a couple of questions, figure out what type of practice you're looking for, the corporate versus the private, and then also kind of have some questions in mind and get into a little bit of dialogue with the person that you call initially to get a feel for the office. That sounds like
right.
It really sounds like the way to start, correct?
Right. As a patient, you want your expectations exceeded. So
okay, that makes a lot of sense too.
You need to let the office know what your expectations are. As a doctor, I want to know what your expectations are so I can exceed them also.
That makes a lot of sense. Speaking of that, I know you do some great things at your office, Dr. Jarris. You hit on it a little bit. Talk to us a little bit about the patient experience when someone comes in to see you.
Well, we really try to make people feel very comfortable here. We're not as formal as most doctors' offices are. I can't remember the last time I wore a tie or a jacket, and we're not opposed to that, but I just don't want people to be impressed with us because we look like doctors or we look professional. I want people to know that we're really professional because of how we interact with them and how we take care of them. So,
well, that sounds like patient-centric, and it sounds like you're focused on results and techniques and technology and doing things the right way rather than just simply presenting a pretty face.
Well, my staff and I love to take care of people. That's our primary goal, and we just love it. We get really excited when we can make a difference for people.
Well, speaking of that, if someone wants to experience that and have that difference made for them, I know you have a really special offer for people out there who happen to be watching this video. Talk to us a little bit about that offer, Dr. Jarris.
Okay. Well, my primary specialty is something called orthokeratology, or ortho-K. It's also known as corneal molding, or eye retainers. And what we can do for people now is we can mold away their refractive error, their nearsight or farsight or astigmatism at night with specially designed lenses that you sleep in. And when you take them off in the morning, you see great for the rest of the day without glasses or contact lenses or anything. This has been done for quite a long time. Not that many people have heard of it because of how eye care has changed. It's all become very commercialized and very fast food type thing, and the doctors don't really have time to do these kind of fancy techniques. But it's been around a while. What is new are some of the designs that have really improved how quickly we can get the results and how thoroughly we get the results. So I've been doing this for 30 years, and I've never been more excited about it in my life. We now know why children become nearsighted, and we also know how to prevent that, how to stop it in its tracks. So I'm very proud to be known as an expert in that, and we are offering for people that see this video, see this interview, 10% off of the full amount. Covers all the visits for a year, pair of lenses, and we're happy to do that for people that come into the office.
Wow, that not only sounds like a fantastic treatment, but also a really, really great offer to be able to take advantage of that. Dr. Jairus, I want to thank you so much for being here today. You know, you've really provided some great insights to our viewers.
Thanks very much, Terry.
All right, everyone. Thanks again for watching another edition of our expert interviews talking about finding a great optometrist today. We look forward to seeing you in another one of our expert interviews in the near future, and have a great day.